This is Our Stigma, Episode 1, Season 1.
Hi, this is Seth Perry. Today's episode will mention overdose, death, and suicide. Check out our show notes for resources if you need help today. Remember, you can always dial 988 if you are in crisis. Before we begin today's episode, I want to give you the question of the day. Ponder this throughout the episode. Here it is. How easy is it for you to access mental health and addiction services in your area right now? Now let's dive in. These are the church bells of Elam Lutheran Church in Scandia, Minnesota. It is the tallest structure in this rural community in the far northeast corner of the Twin Cities metro area. Some may look at the idyllic farmhouses and acreages of Scandia and assume that a growing mental health crisis and the challenges of the opioid epidemic are absent from this place. But I happen to be the pastor of Elam Lutheran Church. I see people in crisis. I work with people struggling to find treatment. I know that in the rural context, people are good at hiding their problems. Today, I've walked across the street from our church to the Scandia Cafe to meet with Geno, a member of Elam Lutheran Church who is open about his past. Geno has lived experience of mental health and addiction recovery in a rural context. So you're 6 years clean. The culture you grew up in here in Scandia, was it a place where you could be open about the fact that you were struggling with addiction?
You would hide that as deep down as you possibly could.
Yeah.
From the world, from everyone.
And when did you start having trouble with addiction?
20 years ago. Long before I figured out that I was an addict.
What do you think causes generations of silence around mental health and addiction here at Elam Lutheran Church in Scandia?
Shame. On the family name, fear of what others may think. I know in the older generations, it is mental health is not spoken about. You sweep that under the rug, and the family is typically the only one who knows.
You have a dual diagnosis, generalized anxiety disorder and addiction disorder. How have you been managing your mental health, knowing that you also have to manage your addiction?
Many of the people in my 12-step groups have the same conditions that I have. Anxiety runs around the 12-step rooms. It's very prevalent. I went to the doctor and we did a general test. I realized that I had anxiety and fear, panic. That was likely a big piece of why I'm an addict.
So how far do you drive to get to your 12-step addiction support group?
I drive great distances to get to meetings. Most of the folks in the cities drive 10 minutes. I drive anywhere between 30 and 60 minutes to get to every meeting that I go to.
So if someone didn't have a car, what would happen?
I would imagine they would suffer greatly. Challenges of rural America are not great in the world of addiction.
What's your assessment on how things are going, knowing that we're in an opioid epidemic and a mental health crisis?
Very challenging.
So did you hear that from 2022 to 2023, Minnesota saw an 8% decrease in overall drug overdose deaths? So how do you make sense of that?
First, I would struggle with believing that fact. The access to chemicals, drugs, alcohol, are greater today than they ever have been.
Is there an addiction treatment center within a 5-mile radius of Scandia?
No.
Is there any addiction treatment center near us?
Yes. 10, 12 miles, Hazelden.
And then how much do you have to pay to go there?
It is $60,000 for a 28-day program.
Are there hospitals offering emergency mental health services within a 5-mile radius of where we are right now?
No.
Are there detox services available within a 5-mile radius of the church?
No.
Is there walk-in crisis counseling within a 5-mile radius?
No.
Are there hospitals with a dedicated mental health and addiction unit within a 5-mile radius?
There are no hospitals within 5 miles.
Are there affordable or sliding scale therapy options within a 5-mile radius of the church?
No.
So we're living within a 5-mile radius.
Not that I'm aware of.
Okay.
The services that are available to those within the city limits, St. Paul, Minneapolis, in the greater suburbs, they have tremendous access to each and everything that you've listed. We have none of those things.
Geno's perspective gives us a glimpse into the barriers to mental health and addiction treatment that exist in Scandia, Minnesota. But this 6-part series can only address the stigma if I journey outside the borders of this small town. Stigma affects all cultures, all identities, all ethnicities, and all faith communities. How do we approach the stigma differently? What do we have in common? I'm Seth Perry, and this is Our Stigma. Our Stigma is a production of Good Faith Media. This production has been made possible with funding from the Washington County Opioid Settlement. The Our Stigma podcast is sponsored by M Health Fairview's Community Faith Partners Network. Before I venture beyond Scandia, Minnesota, we have to start where I work. Rural America. Hunting, fishing, and Jesus. That's what many people think about when they venture outside of the city. In today's episode, you will meet some people who are from the countryside of Washington County in Minnesota. Each personal story in this episode will show us the human side of addiction and mental health in a rural setting. But first, here's one reason why the dialogue on mental health and addiction stigma began at Elam Lutheran Church in Scandia.
My name is Pastor Seth Perry, and I'm the pastor of Elam Lutheran Church in Scandia, Minnesota. This year, I will give up the stigma of my own mental health diagnosis. You see, when I was 17, I was diagnosed with bipolar disorder.
Now, that clip you just heard is from a video I posted in February of 2023. When I first shared my story as a pastor in recovery from a major mental health condition and addiction disorder. The response was overwhelming. So many people reached out, but I never thought that I would find someone passionate about recovery that was in her 90s.
The original pioneer settlers of this land.
They came from Sweden. My grandfather immigrated from Sweden over.
At 94, Pat Johnson never misses church. I sit down for coffee with Pat, her son Chris, and granddaughter Torre.
We had the phone, you were on a line, and maybe there were about 5 to 10 families on the line.
And some of those phone calls would even end up in the paper, right?
Oh yeah, there was a
hearing
lady,
about that.
there was a society lady, and she would sell who you had for dinner that day, or if you had company on Sunday, or if you were going to celebrate a birthday.
Who was this?
I forget her
Columnist.
name.
A columnist?
The social columnist.
Yeah, and she'd print an article. We used to read it in, I think it was the Times.
Living in a small town might feel like your personal life is under a microscope. What was true in the 1930s is still true today. That's what makes Pat's next words difficult to consider. So in February of 2023, you were one of the people that encouraged me when I was public about my mental health diagnosis.
Yes.
And my history with addiction. Why was it important for you to speak up and talk to me about it?
Because I lost somebody very close to me through suicide, and I know how it hurt the family, but we felt shame because we couldn't figure out why it happened, and nobody talked about it.
What is it about living here in a rural place that puts people at risk?
I don't think any of us wanted to admit that our family had that stigma.
And then I think really part of that is people are so much more isolated. And so when people have that hurt inside, you're always trying to, act like it's not there, and you're not open about it. And I feel that, growing up on a farm and doing all the work on a farm, there's, so much work to be done, and that becomes the way of life, and really taking care of yourself and your mental, health is something that, people don't even realize or think about it. They're too busy trying to do their chores,
And when someone would unfortunately die by suicide, it would be
You didn't talk about it. Maybe you didn't even hear about it.
Mm-hmm.
They just passed away.
Yeah.
They passed away, and you didn't know that.
Mm-hmm.
We had one lady who hung herself, and
Pat talks about another suicide from Scandia's past. It's too graphic to share the details. However, Pat's emotion after the admission speaks volumes to the stigma and culture of silence in rural America.
And I know it was with them all the years they lived. All the years they lived. That was such a sad story. But we didn't know what to do about it.
When I listen to the stories from Geno and the Johnsons, one question comes to mind. Why? Why is it so difficult to access mental health and addiction services in rural communities? Why is there stigma historically? Why are people so crestfallen and frustrated when it comes to finding the care they need? I have a few ideas, so I asked a psychiatrist, and we'll meet him after a short break. Talking about mental health and addiction stigma in faith communities shouldn't stop when the episode ends. That's why Our Stigma is more than just a podcast. It's a conversation starter. If you're a community organizer, faith leader, in recovery, or just passionate about community building, I've got a free resource just for you, the Our Stigma podcast educational curriculum. It's a discussion guide designed to help you lead meaningful dialogue on mental health, recovery, and outreach in your community. You can download the leader guide and discussion resource today at www.ourstigma.com. That is www.ourstigma.com. All right, let's get back to the episode.
Want to acknowledge and validate.
This is Dr. Steve Delisi. He is certified by both the American Board of Psychiatry and Neurology and the American Board of Addiction Medicine. Dr. Delisi is also the Chief Medical Officer of Your Path, a telehealth platform that is aimed at improving access to mental health and addiction services.
We are seeing the gaps, the very real gaps that exist in our rural communities in regards to access to mental health care that spans mental health and the co-occurring substance use disorders. That is a reality, and the telehealth and access to telehealth is emerging as one viable option to help bridge that care need. Bringing the expertise and the training of licensed health professionals who may not be physically present in those rural communities, bring them to the individual.
As a pastor, I refer people to mental health services frequently. However, Scandia is a rural community where broadband internet has only recently been rolled out to most of its citizens, not all of them. Asking people to get treatment through their computer screens is a tough sell. Then, Dr. Steve hits me with a dose of reality.
Long term, the ideal service and treatment is in person and within the communities in which people live. Mm-hmm. And so I think we also have to concurrently lift up the initiatives here in Minnesota through the Minnesota Department of Health to expand education and training of our workforce to feel more confident and able to care for people with mental health and co-occurring SUD services.
One thing you keep referring to twice in what you just said is you said co-occurring disorders, and why so frequently are you as a psychiatrist putting that together in the same sentence then?
We meaning our society and our health system have split off our what is often called physical health from mental health, as if they're not part of us as a whole human being. And then we further split off often mental health and substance use disorder, or what some people will call addiction, that they are also somehow separate and distinct. I, I'm I'm saying it the way that I am, trying to help people to hear me from the perspective of how we currently think about these things, but also a call to action, Seth, that we recognize that there really isn't a differentiation from physical health and well-being, mental health and well-being, and what we see when people are struggling with a substance use disorder. That they are all part of the human condition. And I look to a future where both our society and our health systems across the country, in urban and rural settings, and across cultural differences in communities, that we all see that the approach needs to be a holistic, full person approach to health and well-being.
Now, I know the runaround. I spent over 12 years of my life in a cycle. Like, there's no bed space, so I don't get the appropriate care. I don't get the appropriate care because there isn't enough public funding for mental health and addictions, and public care models are stretched so thin that it causes a lack of bed space. And I'm right back at the beginning. And this is why I decided to go to the state capitol. Hopefully, there's a policymaker that can shed some light on the topic. Now, this is Jeremy Drucker. Jeremy Drucker is the director of the Office of Addiction and Recovery. And one more thing, Jeremy Drucker is also in recovery. What policy is in place now, and what policy do you think you need to put in place to make sure that folks in rural contexts can get access to vital mental health and addiction services?
Yeah, it's a real challenge, and it's a real critical issue that we need to address. I think there's a couple things that we can do and that we are doing. I think one thing is supporting telehealth access, so making sure that we have the ability to serve people through either Zoom calls or through phone calls, or some touch point and connection point for people who need mental health services. It may not be ideal as an in-person visit at times, but it can be super meaningful. It can be really impactful. And I think, as you know, as someone in the recovery community, the opposite of addiction is connection. And so how can we increase those connection points? And I think telehealth is one way to do that. I think another thing we need to do is continue to strengthen the behavioral health workforce. So how can we encourage more people to go into the field? How can we reduce barriers to certain roles in the behavioral health field that may not require the same level of education as, say, a full therapist or a full licensed alcohol drug abuse counselor? An example of this is in the governor's current budget. There's a position called a treatment coordinator position. Right now, that requires 2,000 hours of practicum and experience and a bachelor's degree. It really does not require that much much education. Lived experience can make up for a lot of those things, and so the governor is proposing to remove the bachelor's degree requirement and reduce the amount of hours required for training in that to 1,000. Still will give that individual ample experience and expertise in doing that job, but it will lower that barrier and also give people who are in recovery or who have lived experience an opportunity to enter into that field. So those are two things. I think the other thing, too, that we just have to acknowledge and that we have to work on is just the rates that we pay to our mental health and behavioral health providers. So this was something that There was a study done by the Department of Human Services last year that found our behavioral health rates were far too low. And this just becomes a dollars and cents question that the state has to wrangle with, because that's money out of the state budget that we need to appropriate. But I think we need to acknowledge that that's a challenge, and that's something we need to work on.
Are you saying that you'd encourage people in rural communities to think about maybe embracing telehealth options and not looking for face-to-face services, but also consider looking at ways that they can have peer support? Is that correct? Or
yeah, 100%. And I'm glad you mentioned peer support, because I think the role of peer recovery specialists is vital to this. I think they are a really important part of the behavioral health workforce and that continuum of care to support people along the way through their recovery journey. And so, I would certainly recommend anyone who's struggling or anyone who wants to get a connection point to reach out and to make that as soon as possible. And telehealth is probably the most viable immediate option, but really to do what's best for them in consultation with their provider. But don't suffer in silence. Don't suffer alone. As a person in long-term recovery, I spent a lot of time suffering when I was in my use, and I think daily about the years I lost not making that step, and no regrets, because I'm glad I am where I am now. But I would just, none of us deserve to suffer. And I really believe that we all are worthy of recovery. We are all worthy of a fulfilling, self-directed, purpose-filled life. And there's a lot of different pathways to get there.
The perspective of doctors and government officials are one thing, but in order for you to experience what it's really like, I want you to meet someone who is in early recovery from rural Washington County. We'll do just that after this break. The Our Stigma podcast is produced by Good Faith Media, a reliable resource contributing to conversations at the intersection of faith and culture. My friends at Good Faith Media use multiple media platforms. Their flagship podcast is Good Faith Weekly, hosted by Mitch and Missy Randall. Each week, the co-hosts discuss current events and issues, engage the lighter side, and interview faith leaders from around the world. Learn more about the podcast and the nonprofit Good Faith Media at goodfaithmedia.org. You are about to meet someone who was baptized and raised at Elam Lutheran Church, the very church that I pastor, but he's still in outpatient treatment. So that means I have to drive 25 minutes south of the church to a supportive living facility to meet him. This is Marty, a name that we are using for his own anonymity.
But when there's a nice day out, it's nice to get out here, walk, get down to the river. Even when it's cold out, the sun's shining, you feel the warmth. It reminds you that you're part of something bigger for sure.
How long ago was your intervention?
The intervention was just a little bit over a year now. So it was back in November 2023.
Yeah.
And that was a really rough, chaotic period of time. I had lost a lot in life, both in terms of relationships. Family was kind of being pulled apart. I lost my mom to cancer. And really all I had left was an apartment in Woodbury, and I was on the verge of being evicted from there. So it was one of those times, where the intervention, as difficult as it was to accept, I think it was a perfect kind of, I don't want to say divine intervention, because it was the
divine intervention. It was a group of people from the church.
Sure, it was a divine intervention.
Group of people from the church stepped in and hired the best help we could find. Yeah, I mean, after Marty's intervention, he needed treatment. Marty went to detox and ended up on state medical assistance. Marty started talking about some very specific problems he faced in treatment. It prompted me to ask this question. You eventually are 45 minutes away from your home, and you're in a treatment center where you've got a half a day of programming, but then people can go anywhere, and you're saying some people were using. So what did that look like?
So people would go out, come back, and you could just tell that they were out of it. They were out of their mind. People came back and were very aggressive with staff, especially. There weren't enough staff to safely kind of control the environment. So there was definitely fentanyl use, there was definitely methamphetamine use, there was definitely heroin, probably everything nowadays, everybody says everything is laced with fentanyl. I felt isolated. I felt disconnected from my home, even though, relatively 45 minutes isn't terribly far away. I understand that, but just the inability to communicate with people, I felt isolated, even though I was surrounded by more people than I had been for quite some time. With my second DUI, I just found it kind of interesting because I was placed into max security at the jail in Dakota County, and it was just interesting. I felt almost safer in that environment. I felt like I was connecting on a deeper level with some of those guys who, honestly, I never thought I would be in that kind of situation.
This is an answer I did not expect. By no means is this the average experience when a person ends up in residential treatment, but it isn't unheard of. One thing is for sure, Marty is speaking about the barriers he faced in finding the help that he needed.
Why was it so hard to navigate the mental health system for you?
I think back to high school, and I don't remember much of any discussion about mental health. The stigma and just the lack of conversation, because now being part of the recovery community, whenever I mention it, it's almost everyone has some connection to someone or themselves, some sort of mental health diagnoses or some sort of substance-related experience.
You grew up at Elam Lutheran Church. Was there ever any discussion about mental health and addictions at the church you grew up in?
There was not. I do not remember much at all in terms of discussions about mental health.
Well, let's head inside.
Okay.
Let's warm up.
Marty and
inside.
I continue our conversation in the living room of his supportive living facility. It has been over 1 year since he's been back to his hometown.
Being in a small town, you kind of got to know not everybody, but you knew the community pretty well.
Church every Sunday.
Church every Sunday, 100%.
What's the process been being disconnected from your roots like that?
There's been a grieving process there. There's a sense of loss. It just felt like an uprooting, like a tree being pulled, the roots being just pulled from the ground, and coming to terms with the understanding that is no longer a place for me.
Just for everyone's geography, basically, you have had to seek treatment at least 25 minutes, 45 minutes, 55 minutes away from you. Your detox center is about an hour away. That first detox was about an hour away from you. So you're even looking at going out of county for the help that you got.
Right, and one of the big factors was with the DUIs, in terms of transportation, there was none. I can't get an Uber out to Scandia.
Right now, if you wanted to, on a Sunday morning, go to church and see everybody that you grew up with, everyone that you're connected with back in Scandia, what are your options?
There's really nothing. I would have to order an Uber, and I mean that price is going to be astronomical. Here in Lakeland, I do have UCare. I can set up for the next month rides to treatment and back every day. They don't do rides to, say, church.
Take note, this won't be the only time that someone expresses feeling uprooted in this docuseries. Over the course of the next 6 episodes, you will hear from people in a variety of cultural and spiritual contexts. Just like Marty, people will tell how they have been uprooted from their faith and their families. But addiction affects family members in a very specific way, which is why I am heading back to Scandia to introduce you to someone with a unique perspective. Kitty corner to the church is the Libby Law Office. I want you to meet Kirsten, lawyer, faithful churchgoer, and Scandia City Council member. She's accepted my invitation to talk about her unique perspective. Kirsten has been affected by her loved one's addiction. she sent her daughter Libby to treatment numerous times. When did you first notice that Libby was having some challenges with addiction that were just beyond your average issues that a young person may have with addiction?
You know, that's a good question. Growing up, you know, at least where I grew up, you'd go and drink beer in the cornfields. With Libby, and I think with a lot of people in her crowd, it wasn't drinking beer in the cornfield. It was drinking Jack, or it was drinking Jameson, or it was drinking Fireball, or it was drinking Captain Morgan. It was hard stuff right off the bat. And, you know, when she went to college, I think it exacerbated, and I think that it probably took hold in college, and then she was never able to get out from under the weight of it, ever. She was sober when she went to treatment, and she was not sober when she didn't.
So tell me about getting her into treatment. How did that end up happening, that you were able to get her to treatment?
Well, we talked about it a lot when she was in college, and not a lot, but we talked about it, and I just always made sure she knew that the door was open, and when she was ready, whatever she needed. And the first time she went through treatment was she was living in Chicago, just outside of Chicago with her boyfriend, and working at a bar, which doesn't work so well when you don't have an off switch. And I remember calling, and she didn't want to lose her boyfriend. So she went into treatment in Chicago. And that was the first time. It worked for a little bit, and then it didn't work. And she ended up moving back to Wisconsin and living at her dad's cabin and working at a bar. And same thing. It's talk when you're ready. And then she moved from Wisconsin to my house. Went to treatment probably 3 or 4 more times in 4 or 5 years, and it was just hard for her.
And where did she end up going to treatment when she was living here in Scandia?
Let's see if I remember. She went to treatment during COVID, and I don't know if that was hard, because it was a different treatment plan, obviously. But she went to Hazleton, I think twice. Then she went to someplace in Eden Prairie, down in that area, and then she went to someplace in St. Paul.
So you did send her to the best treatment money could buy, too, really. I mean,
So says the literature.
So says, yeah. Mm-hmm.
You know, and you can be in the best place in the world, but if you're not ready, or your body is not, and your mind are not capable of internalizing what they have to offer, it doesn't matter.
You are hearing the voice of Kirsten's daughter, Libby. She is singing on the grounds of Hazelden Betty Ford while in residential addiction treatment in April of 2021. This audio recording was captured a short drive from the center of the small town of Scandia, Minnesota.
Well, I found her. And interestingly enough, in one of our family programs and that I had gone through with her, I said one of my biggest fears would be I find you dead. And I did. when I found her, we called 911, and Scandia Fire and Rescue came out.
Take your time.
And then they took her, and it was like, whoa, shit. And one of the paramedics came back that night. With flowers, and said, you don't have to go through this alone. So you have a whole community here standing behind you. And that was true.
What Kirsten just described is something that's at the heart of this podcast: human connection, our need for support. It is supposed to transcend all boundaries. It is supposed to transcend all of our differences. Human connection is in many ways the antidote to stigma. For instance, that very paramedic that Kirsten mentioned, that person would have seen Kirsten out in public, would have seen Kirsten at church, more than likely would need legal advice at some point in their life. So at least that bouquet of flowers that were delivered to a grieving mom within hours of her daughter's death are a sign that things are changing in Scandia after years of silence, shame, and stigma. However, this is just one community, one cultural perspective, and one faith context. We live in a diverse world, and many people will tell you that there is no one-size-fits-all solution for addiction. That means this is only the beginning. Join me next episode as we journey outside of the rural context. Come along with me as we explore how overdose deaths affect communities differently. It's time to explore racial inequity in overdose deaths. Our Stigma is a production of Good Faith Media. This episode was produced by Cliff Vaughn from Good Faith Media with the support of Mitch Randall and Callie Chisholm. Audio provided by Pond 5. Special thanks to Sean and Rolando from Washington County and Diane from mHealth Fairview for their contributions. Thanks to everyone who was interviewed: Geno, Dr. Steve Delisi, Pat, Torre, and Chris, Jeremy Drucker, Marty, and Kirsten Libby. I'm Seth Perry, the host, writer, and creator of Our Stigma. If you enjoyed this episode, please take a moment to leave us a 5-star rating on Apple Podcasts. It really helps the show grow. And if you want to follow me, go to Our Stigma on YouTube. Visit ourstigma.com for the educational discussion series that accompanies this podcast. See you for episode 2.